over the lines and wrinkles on our face, and yet perhaps the most revealing expression of beauty is a big, healthy smile.
That right there, here to brighten our chompers and restore that youthful glow from the inside is Dr. Michaela Tozzi. She is a cosmetic dentist and owner of Tozzi Dental, along with her patient, Paula Mason. It's great having both of you. How are you?
Thank you. It's great to be here. So excited.
Smile makeovers for aging patients, this is a huge deal lately.
It is. And you know, we really have the plastic surgery industry to thank for that, because plastic surgery is so commonplace now, from facelifts to neck lifts to Botox fillers. I mean, who isn't getting that stuff done anymore? Yeah. But what they were finding is, after investing all of this money into their face, something was still missing. They didn't have that bright, youthful smile that really completed the look. Our smile really shows our age.
Isn't that true? Yeah. No, it's really true. You can spend hundreds of dollars on the haircuts and the cosmetics, but when you don't have a healthy mouth, like, it's very apparent.
It's the rings of the tree, frankly, are right here. This is, you certainly. And if you don't get that fixed, it doesn't matter what else you get. You're welcome.
So, Dr. Tozzi, you do something called the Smile Makeover, and you deal a lot with patients with aging smiles. What are some of the signs of an aging smile?
So there are several telltale signs that maybe a smile has been around for a while, if you will. Two of the most common signs are shortening of the teeth, and then hodgepodge dentistry, as I like to call it. But let's go back to shortening of the teeth.
Okay.
As we age, our teeth start to wear and they become shorter and shorter. Maybe the patient's clenching, grinding, or just overall wear in general. So when you smile, your teeth become a lot shorter. You're not showing as much of your teeth as something you would see in a more youthful smile. Secondly, the hodgepodge dentistry aspect of it. A lot of us go to several different dentists over the course of our years.
And they're all of varying levels of goodness.
That is true. That is a good point. So, you know, they might have a white filling that was done here 10 years ago, a silver filling over here that was done 5 years ago, whatever, and it starts to stain the teeth gray, an old crown that has metal underneath it, and you get the black line up at the gum line. That's not typically a good look.
Paul, let's talk about your situation. Where were you before you have this lovely smile?
I had a chipped tooth in the front.
Oh, no.
In an emergency, and I went, oh my gosh.
Oh, is this it? Oh my goodness.
You should see the other girl.
You should see the sliding glass door.
Yeah.
Oh no, it was
it really a sliding glass door?
I ran right into it.
Oh, I'm so sorry. We've all done it. But you chipped your tooth.
And I went into doctor, and she was going to bond it for me, and I go, but I want something else. It needs something. So she recommended veneers, and it was amazing. And I just went, she showed me the before and after. I went, oh, those were my teeth before? Oh my God.
It's unbelievable when you see the before and after, and it really blows your mind. Have your teeth ever looked this good? I mean, it's remarkable.
No. And all of my friends that are in their 60s, I'm always looking at their teeth now going, ooh.
Call my girl. Once you upgrade, then you kind of have that perspective. So, Dr. Tozzi, you approach everyone individually.
Correct.
And you specialize in cosmetic dentistry, but you perform many procedures. So we have some photos of Paula's mouth. Let's just talk about what you did with her individually.
Sure. Absolutely. So in the top photo, you can see this is after we actually did some bonding on that right front tooth where she had chipped it. But during that conversation, you know, this was just a temporary thing. And during that conversation, I said, well, you know, why don't we take a look and see what we can do to kind of artificially correct some of the teeth that are maybe a little bit out of alignment, so to speak. And so we went with 10 veneers on the top, and then we did a cleaning and we did zoom whitening on her lower teeth, which you can't really see in the after photo, but overall it just kind of softened up her smile a little bit.
Zoom whitening.
It's very important, because I have 6 crowns here, but the bottom, it doesn't matter if you get the cleaning or whatever, they can get a little bit.
It's a struggle. Yeah, it absolutely is.
The struggle is real.
It's real. And that's the problem. Once you get porcelain veneers or crowns or whatever, those stay the color that they are. So you really want to make sure that it's a color you're comfortable with and that you can maintain with the rest of your teeth, keeping them as white as the artificial veneers or what have you.
How many visits does a smile makeover take?
Typically 2 to 3 visits. First visit is we take some molds of your teeth, kind of talk about what you're looking to achieve. Second visit, we prepare the teeth and you leave with temporary veneers on. Third visit, you come in, we cement the permanent ones on.
Awesome.
Interesting.
Yeah.
I'm just looking over at Paula. She's smiling. I'm just so glad. It doesn't feel good though?
Yes.
When you can just show your mouth and you know, like it reflects how you feel, which is so great.
It does.
This Zoom teeth whitening, so I don't have any veneers, doctor, but I have a love of coffee and tea. You've tested a lot of different teeth whitening. Why do you think Zoom is so great?
You know, you're absolutely right. I've tested so many different in-office whitening treatments, and what I found is they'll tend to brighten the teeth, but they're not whitening. They're not jumping us, 1, 2, 3 shades whiter. And to me, it's kind of a waste of everybody's time and money if we're not getting the results that we expect.
Of course.
Zoom whitening, I found it'll jump patients' teeth from 1, 2 to I've even seen 5 shades whiter.
Wow.
And it lasts. I mean, it depends on your diet. Coffee, tea, wine drinkers, that's gonna darken darken a little bit quicker. But overall, most patients, they'll come to me and do Zoom whitening maybe every 6 months, every year.
For upkeep.
Yeah,
Great.
for upkeep.
Awesome. It's
Absolutely.
great having you.
Thank you so
You look
much.
fantastic. It's great having She's like, I'll stop it. Keep going.
Zoom in.
Exactly. Zoom. There we go. Be one of the first 10 people to call in right now. You're going to receive 50% off a Zoom whitening treatment at Tozzi Dental. That's a $250 cost to you. Normally it's $500. You're also going to receive a complimentary smile makeover as a consultation as well. And the information is right there on your screen.
Beautiful. Tozzi Dental is located on Pecos Road in Henderson. Their number and website are up on your screen. See more great examples of her work on Facebook and Instagram. Dr. Tozzi is a proud sponsor of the Morning Blend.